My name is David Saper. I'm an orthopedic surgeon with fellowship training in sports medicine. I have extra training in minimally invasive techniques, and this is called arthroscopy, where instead of putting the traditional, utilizing traditional incisions to get to a joint, we can do it with a camera, of providing minimally invasive techniques to address the problem inside the joint. The work inside the joint is the same as the traditional open procedures that are often employed. The goal is, though, to get to the joint or get to the problem using small incisions and often a camera and specialized instruments so that we can cause less damage to the area before we get to the joint. The rehabilitation is often much more advanced. So we can get you into therapy faster, your pain is much less than a traditional surgery would be, and you can work with a therapist to get the best result possible sooner. Specific clinical interests of mine include cartilage work in the knee. If the patient is a candidate for a cartilage transplant, that's something we can explore with the patient if they're the right candidate. Other interests we have is if you're the right patient, we can sometimes consider, instead of a total knee replacement where the whole entire knee is replaced, again, if you're the right candidate, we can consider a partial knee replacement. The benefit to the patient is you keep more of your knee. So it goes with our philosophy of trying to do the least amount of surgery possible for the best effect possible. So one of the great benefits of St. Francis Hospital is that it's a very busy level 1 trauma center. And again, it means that the staff here is very skilled, very competent, and very used to seeing the worst and routine things. So from the check-in desk to the ER to the nursing staff to the anesthesiologist, the whole team here at St. Francis really is competent and capable of taking care of the patient effectively, which is really what any patient wants at the end of the day. Tom is a very pleasant police officer in the Chicago Police Department who came to me with a ruptured quadriceps tendon, which is a serious problem because that means you can't extend your knee, and it's very difficult to stand and it's very difficult to walk on it. So we saw Tom immediately, diagnosed him immediately, and put him in the operating room as soon as possible to fix his knee so that he can get back to walking. After surgery, he did a lot of functional rehabilitation and physical therapy to have the great result that he has now. So once Tom is fully recovered, which he is nearly there, our expectations for him is to return to work as a police officer and use his knee and go back to running and jumping and squatting, all the activities that he could do before. So that's our goal for Tom, and quite frankly, I think he's pretty much there.